Did you know that some of the biggest stars in history didn't die from old age or illness, but from preventable medical errors? In today's video, we're looking at celebrities who died during routine surgery and the medical negligence cases that shocked the world. From unauthorized procedures to deadly prescription drug combinations, these are the preventable tragedies that prove even fame can't protect you from a fatal medical mistake. And stick around for our final story, a surgeon so dangerous he was nicknamed Dr. Death, and the chilling email that proved his crimes were no accident. Joan Rivers was a legendary comedian, sharp and unstoppable even at 81. But on September 4th, 2014, the world was shocked by her sudden celebrity death. What was supposed to be a routine throat procedure at a New York clinic turned into a fatal medical error. Federal investigators later uncovered a series of unauthorized medical procedures performed without her consent. Perhaps most disturbingly, reports surfaced that staff took celebrity selfies while she was sedated. By the time they realized she was suffering from lack of oxygen, the irreversible brain damage was done. Bill Paxton was a beloved actor in Titanic and Aliens, but his life was cut short in 2017 following complications from heart surgery. He was only 61 when he underwent a procedure to repair an aortic aneurysm. Paxton's family filed a wrongful death lawsuit alleging the surgeon used high-risk, unconventional methods without informed consent. Reports indicate the lead surgeon actually left the operating room before the patient was stable, leaving him vulnerable when fatal complications began. In 1987, the king of pop art, Andy Warhol, died after what should have been a routine gallbladder surgery. While the surgery was successful, his post-operative care was a disaster. Medical records suggest a case of medical negligence involving fluid overload. Doctors reportedly pumped his body with more internal fluids than his kidneys could process, leading to sudden cardiac arrest. The hospital eventually settled a malpractice lawsuit, but the world lost an icon to a simple hospital error. Michael Jackson's passing in 2009 remains the most famous celebrity overdose in history. To treat his chronic insomnia, his physician, Dr. Conrad Murray, administered Propofol, a powerful surgical anesthetic, in a private bedroom. This was a massive violation of medical safety protocols. The subsequent involuntary manslaughter trial revealed a reckless disregard for human life, marking this as a preventable medication error that ended the life of the king of pop at just 50 years old. Joan Ritter's death is a tragic case of emergency room misdiagnosis. In 2003, Ritter was mistakenly treated for a heart attack. The real killer was an aortic dissection. Had doctors performed a simple chest X-ray, they likely would have caught the tear in his artery. This wrong diagnosis led to his death at age 54, eventually sparking new medical life-saving protocols known as the Ritter rules. Maurice Gibb of the Bee Gees died in 2003 due to what his family called a failure in medical care. Doctors failed to immediately identify a twisted bowel, a treatable but life-threatening emergency. The situation turned fatal when his bowel burst, causing cardiac arrest. Shockingly, reports claimed it took hospital staff over 10 minutes to locate a defibrillator. This delayed emergency response silenced a musical genius at age 53. In 2004, Rodney Dangerfield underwent heart valve surgery at age 82. The goal was to improve his health for a future brain operation, but he suffered post-surgical complications that led to a coma and his eventual death. His story highlights a grim reality in medicine. Sometimes the preparatory surgery is more dangerous than the condition it's meant to fix. On the day of Dangerfield's death, The randomly selected joke of the day on his website happened to be, "I tell ya, I get no respect from anyone. I bought a cemetery plot." The guy said, "There goes the neighborhood." This led his wife, Joan Dangerfield, to choose "There goes the neighborhood" as the epitaph on his headstone. The death of Heath Ledger in 2008 is a haunting example of the dangers of doctor shopping. At 28, Ledger died from a toxic combination of 6 different prescription medications. Because he was seeing multiple doctors, no single physician had the full picture. This accidental overdose sparked a massive conversation about prescription monitoring programs and how a single question from a doctor, "What else are you taking?" might have saved his life. Marilyn Monroe's death is the ultimate Hollywood mystery. Officially ruled that she probably took her own life by acute barbiturate poisoning, her passing is often linked to the overprescription of sedatives in the 1960s, the lack of patient monitoring, and the ease with which she obtained dangerous levels of medication remain a dark, cautionary tale of celebrity doctors. While most stories today ended in tragedy, this one is a harrowing medical near miss. In 2007, actor Dennis Quaid's newborn twins were victims of a massive hospital medication error. They were accidentally given 10,000 units of a blood thinner instead of the prescribed 10 units, a 1,000 times overdose. Quaid said the error turned their blood to the consistency of water. They survived, but only because their father became a pit bull for their safety. The voice that defined the sound of music was silenced in 1997. A routine surgery to remove non-cancerous nodules on her vocal cords went horribly wrong. Julie Andrews went in a soprano and came out unable to sing. She filed a medical malpractice lawsuit that eventually settled, but the world lost one of its greatest instruments forever due to a surgical mistake. You stayed until the end, and this is the story that will haunt you. Most stories today are about accidents, but Christopher Dunch, known as Dr. Death, was different. He was a neurosurgeon who left a trail of 33 mutilated patients in just 2 years. In a private email, he literally wrote, "I am ready to become a cold-blooded killer." He didn't just make mistakes, he bypassed the safety systems designed to protect you. He is currently serving life in prison, a reminder that sometimes the dark reality of medical mistakes isn't an accident, it's a monster in a white coat. What's your biggest fear about going to the hospital? Let us know in the comments. And if this story shocked you, hit that subscribe button. Your support helps us expose the truth. Thanks for watching.